This is a Montana Medical Association sponsored community vaccination and COVID-19 prevention and status update, and we're glad that you could join us. I would like to thank you all on behalf of the Montana Medical Association and our expert partners for joining us here today. We greatly value the work you do and appreciate you taking the time to be with us to discuss this important topic at such a critical time. I am Dr. Carly Robertson, President of the Montana Medical Association. We are the leading physician-only organization in Montana, representing over 1,400 physician leaders in all areas of our state. Since 1879, the MMA has served as a unified voice for Montana physicians dedicated to improving patient care. Our goal is to help our members advocate for the medical profession, for quality patient care, and for the health of all Montana citizens. I am joined today by expert leaders to provide you with an update from Montana's medical community on the continued impact we are seeing from COVID-19. As we start this new year, the pandemic continues to impact our health and daily lives. As we look toward 2022, it is important to remember that while the pandemic is not yet in our rearview mirror, we have more tools available this year than were available last year. Millions of people across the globe and 53% of Montanans are fully vaccinated against COVID-19, preventing serious disease, slowing the spread in our communities, a true triumph. Plus, now, anyone over 5 years of age can receive a free COVID-19 vaccine, and new treatment available include monoclonal antibodies, antivirals, steroids, to help those who actually do contract the virus. There are promising new medications that are hopefully going to keep people out of the hospital. When you end up in the hospital, our physicians and nurses and the treatment teams now understand better how to support your ventilatory needs. The course has not been a straight line, with new, much more transmissible Omicron variant now spreading across Montana. We've had over 1,900 Montanans test positive yesterday. Cold weather continues to keep people indoors and increases the likelihood of spread. I am confident that we can work together as Montanans, however, to prevent suffering, prevent stress and burnout to our hospitals and the people who staff them. I'm going to turn the floor over to a series of my expert colleagues who will give us all an update on the pandemic, how we as individuals and Montanans stay safe and healthy into 2022. I will hand it off to our first speaker, Dr. Maggie Cook-Shemanek. She is the acting state medical director of Montana. Dr. Cook-Shemanek is board certified in occupational and environmental medicine, public health, and preventive medicine. After Dr. Cook-Shemanek speaks, she will then hand off to Dr. Koo. Dr. Koo is a board certified infectious disease physician and specialist. He is an epidemiologist currently working with the Billings Clinic. Dr. Koo will speak and will then hand off to Mr. Rich Rasmussen, who is the CEO and president of the Montana Montana Hospital Association. And the last speaker of the day will be Dr. John Cole, a board certified pediatrician practicing in Kalispell. He is the current president of the Montana chapter of the American Academy of Pediatrics. Following that, we will come back to Dr. Greg Holtzman, who will assist the press in answering questions that they may have. Dr. Cook-Shemanek.
Thank you. And I want to say thank you to Dr. Greg Holtzman and Dr. Carly Robertson for the invitation to come and provide a state COVID-19 update. So what follows is the most recent data related to COVID-19 cases, hospitalizations, variant information, and also vaccinations. The data that I'm going to discuss today is for the week ending January 7th, 2022. So last week, there were 6,305 reported COVID-19 cases, which represents an increase of 136% from the prior week. Laboratory testing was also up with 42,771 tests run. This represented an increase of 81% from the prior week. For hospitalizations, there were an average of 141 hospitalizations per day, which was up 17% from the prior week, and there were 13 deaths last week. In terms of vaccination, when we look at the COVID-19 vaccines administered for those 12 and older, from last week's data, we see that 57% of those 12 and older eligible population has been fully vaccinated, and 64% have had at least one dose administered. When we roll in the 5 to 11-year-old age group, we see that 53% of the Montana population is fully vaccinated, and 60% have had at least one dose administered. I wanted to take a moment to talk about some pediatric summary data that we've pulled for the period between September of 2021 through December of 2021. During that time period, there were 12,721 cases of COVID-19 in children less than 18 years of age. For the same time period, there were 71 hospitalizations. To date, the state has confirmed 19 cases of multisystem inflammatory syndrome in children, and no deaths have been reported in that regard. For the pediatric population specifically, when we look at the 5 to 11-year-old age group, we see that 13% of that population who's eligible for vaccination is fully vaccinated. For the 12 to 17-year-old age group, 38% of those individuals are vaccinated. I wanted to take a moment to talk about Omicron because that's at the top of people's minds right now. As of January 11th, DPHHS laboratories had detected 174 cases of Omicron in Montana, and that's occurring in over half of Montana's local and tribal health jurisdictions. Last week, 84% of the specimens collected and sequenced at the state lab were Omicron, and that compares to 70% of the specimens sequenced the week prior. The remainder of the samples that were sequenced were the Delta variant. So at this point, we do consider the Omicron variant to be the dominant circulating strain in our state. So it should be noted that more cases of Omicron are likely exist, but DPHHS and its partner labs don't sequence every positive COVID-19 test that they receive because the current lab sequencing is intended for surveillance purposes only. I also wanted to provide a brief update on therapeutics. So as many of you know, the state receives allocations for federally purchased products, including the monoclonal antibody therapeutics, and more recently, the oral antiviral products. So we receive a weekly allocation of the monoclonal antibodies and receive the oral antivirals every 2 weeks. We're largely working with our federal retail pharmacy partners to distribute the oral antiviral products and continue with the same process as before for distributing the monoclonal antibody therapeutics to facilities around the state. So that concludes my update. And what I'd like to do now is turn it over to Dr. Neil Koo, who will also provide updates.
All right. Good afternoon. I would like to take this opportunity to provide to you all a brief overview of the COVID-19 in Montana, what we know about the Omicron variant, current outpatient treatment for COVID-19, and updates on the CDC vaccination recommendations, as well as the quarantine and isolation guidance. In the past week, we have seen cases of COVID-19 as well as hospitalizations significantly increase in the US, now surpassing previous records. Likewise, Montana recently experienced a significant increase in cases of COVID-19. Over the past weekend, almost 2,000 new cases of COVID-19 have been reported. Hospitalization due to COVID-19 are also slowly trending upwards and expected to increase significantly in the coming days. Several factors are likely to contribute to this exponential rise in new cases. Firstly, the opportunities for uninfected individuals to be exposed to infected individuals had been increased with the three major holidays we recently had. Secondly, a significant proportion of the Montana population remains unvaccinated or up to date with COVID-19 vaccination. Thirdly, the presence of the highly transmittable Omicron variant has now officially been verified in Montana and has displaced Delta variant as the predominant variant in the state. Although researchers are still learning more about the Omicron variant, there are several key factors about this variant that have been identified. Multiple mutations in the viral genome, which have been found, which allows the Omicron variant to be more transmittable. The Omicron variant is approximately 200% more transmittable than the Delta variant. And the Delta variant is approximately 200% more transmittable than the Alpha variant that was noted over a year ago. Individuals infected by this variant are also found to have substantially higher viral load in their respiratory tracts. This means that an infected individual produces more virus, thus readily allow the spread of the virus to more uninfected persons. The incubation period of this variant is also shorter than previous variants. Instead of an average of 5 days, the incubation period of this variant is closer to 3 days. Finally, there is evidence that the commonly used monoclonal antibodies, specifically bamlanivimab, etesevimab, and casirivimab and imdivimab, are substantially less effective against the Omicron variant. Clinical reports from various parts of the world and in the US suggest that infections by the Omicron variant typically result in milder illness, particularly in those who are up to date with the COVID-19 vaccine. However, it is important to bear in mind that severe illnesses and deaths still occur in those who are infected with the Omicron variant, particularly those who are unvaccinated, not up to date with their vaccination, and those who are severely immunocompromised. Those who previously had COVID-19 are also at risk for reinfection, as the Omicron variant can invade the immunity acquired from the previous infection. Although the infections by the Omicron variant seem to result in fewer hospitalizations and deaths when compared to the Delta variant, it is important to note that substantially more people are infected by the Omicron variant than the Delta variant. As such, the number of hospitalizations and deaths due to the Omicron variant can match and exceed that of the Delta variant. Despite the earlier concerns of reduced effectiveness of currently available COVID-19 vaccines, studies have shown that individuals who are up to date with their COVID-19 vaccinations, that is, those who are fully vaccinated and received the booster dose, were able to maintain significant effectiveness against the Omicron variant. Additionally, vaccination provides those who have been previously infected additional protection against reinfection. As such, vaccination remains the most important and effective strategy in preventing severe illness, hospitalization, and death due to COVID-19. 3 recent changes in the CDC and ACIP vaccination recommendations will help improve the vaccine effectiveness in more individuals. Firstly, children ages 5 to 11 years who are immunocompromised are now eligible to receive an additional primary vaccination dose at least 28 days after their second vaccine dose. So in effect, it's a third vaccine dose. Secondly, children ages 12 to 17 years will now be eligible to receive a booster dose. Finally, all individuals eligible to receive the booster dose will only have to wait 5 months instead of 6 after the last primary vaccination dose. In addition to vaccination, other transmission-based measures such as wearing face masks, physical distancing in public, and avoiding large public gatherings, particularly indoors in the indoor settings, will provide further protection from exposure to the Omicron variant. The degree of protection is cumulative to the number of measures employed. That is, the more measures an individual practices, the more the individual can be protected. As I mentioned earlier, 2 commonly used monoclonal antibody therapies have been found to have significantly reduced effectiveness against that Omicron variant. Recently, the more treatments have become FDA authorized for the outpatient management of COVID-19. They significantly reduce the risk of progression to severe illness that may lead to hospitalization and death due to COVID-19 in high-risk individuals. These treatments include a recently introduced monoclonal antibody, sotrovimab, and 2 new oral antivirals, molnupiravir and nirmatrelvir with ritonavir. Additionally, a recently published study has noted that the currently used antiviral agent, remdesivir, when used on high-risk, non-hospitalized COVID-19 patients, prevented progression to severe illness by 87%. Finally, although this is not a treatment for COVID-19, a new monoclonal antibody, tixagevimab, silagevimab, have been FDA authorized for the use of pre-exposure prophylaxis in individuals who, with medical conditions, who are expected not to elicit a significant immune response to the COVID-19 vaccines, or to those individuals who are unable to receive the COVID-19 vaccines. However, it is important to understand that this monoclonal antibody is not a substitute for vaccination. It is hoped that these new therapeutics will mitigate the potential surge of hospitalized patients and deaths due to the Omicron variant. I will conclude my portion of this press conference with a quick overview of the updated CDC recommendations on quarantine and isolation durations. The quarantine duration of individuals who are exposed to COVID-19 will depend on their vaccination status. Those who are up to date with their COVID-19 vaccination will not be required to be quarantined as long as they remain without symptoms. Individuals who are not up to date with their COVID-19 vaccination should remain in quarantine for 10 full days after their exposure. For both of these scenarios, CDC also recommends monitoring for symptoms for 10 days and testing for COVID-19 at least 5 days after the exposures. Certainly, if COVID-19 symptoms develop during the 10-day period after exposure, should get tested immediately and stay home while waiting for the test results. The isolation duration of individuals who are diagnosed with COVID-19, that is having a positive COVID-19 test with or without symptoms, is 5 days for most individuals if the COVID-19 symptoms are improving and they have been fever-free without the use of fever-reducing medications, or if they have been without symptoms and remain asymptomatic. Additionally, these individuals should continue to wear a mask while around others, especially those who are high risk, for an additional 5 days. Thank you very much. And I'm going to now pass it to Mr. Rasmussen for his portion of the press conference.
Thank you, and thank you, Dr. Koo. Now, as Dr. Koo mentioned, the Omicron variant is highly transmissible. This rate of transmissibility of the Omicron variant has begun to drive up rates of both infections and hospitalizations in our state. Now, this wave is different, and it has the potential to tax our hospitals more than any previous wave. Our baseline census, or the number of patients in our hospitals, is higher than it has ever been at any other point preceding a pandemic surge. Now, so as we enter our third year of the pandemic, it's hard to believe it's our third year. We're also dealing with an acute staffing shortage. Hospitals have fewer staff who must care for our patients. They must care for more patients. These dedicated caregivers are stretched very thin, especially when they or their colleagues have to isolate due to exposure or contracting this highly transmissible variant of COVID-19. Now, during our fall surge of COVID-19, hospitals were operating at or above capacity for more than 10 consecutive weeks. In fact, if we look back at the whole fall was a surge for us. And most of that time, the COVID patients represented 20 to 25% of all hospitalizations and filled our intensive care units. The overwhelming majority of these patients, unfortunately, were unvaccinated. Now, without a slowdown to spread COVID-19, hospitals will once again be forced to consider a return to crisis or contingency standards of care. Now, this means non-emergent procedures will be postponed. This doesn't mean such procedures aren't critically or clinically important. Often referred to as elective procedures, these procedures include serious conditions. Now, it's important that we ask any patient or patient of a family member if they feel comfortable delaying their aneurysm repair, a hernia surgery, removal of kidney stones, or an appendix or hip replacement. When all hospitals are overwhelmed and hospital workers are stretched, and when they're stretched thin, care for everyone suffers. But there's something we can do. We can all get vaccinated. And now that includes kids and teens. Our hospitals are seeing an increasing number of younger patients with COVID-19, including parents to young children and pediatric patients. It is difficult to care for our caregivers, or let me say it's difficult for our caregivers to see such young people suffer from disease that is preventable with a safe and effective vaccine. And we urge parents and caregivers to talk with their family physician and get your kids vaccinated. It is the best defense against the virus. It is also their ticket to maintaining a life full of play, learning, and time with loved ones. Vaccinating kids and teens can help protect family and friends too, especially those who are vulnerable due to medical conditions or unable to receive vaccines themselves. So here's the message for Montana's hospitals. We all have a role to play in slowing the spread of COVID-19, and we must protect our healthcare resources for all who need them. So parents, please meet with your physician, take your kids in, and get your kids vaccinated for COVID-19. That's the most important gift, and quite frankly, it should be our New Year's resolution as we move into 2022. So now I'd like to invite Dr. Cole from the Montana chapter of the American Academy of Pediatrics to share his remarks this morning.
Thank you, Rich, and thank you all for joining us this afternoon. So I am a practicing general pediatrician in Kalispell, Montana. I also am the president of the Montana chapter of the American Academy of Pediatrics, and our organization represents almost 150 board-certified pediatricians across the state of Montana. As Rich had mentioned, the hospitals are seeing record levels of patients with COVID, and this is also happening in the pediatric population. According to the CDC, the number of children currently hospitalized from COVID-19 in the United States has increased to 2 out of every 100,000, which is the highest since the start of the pandemic. And the children's hospitals are getting overwhelmed. The largest spike of pediatric hospitalizations are among those under 5 years old. None of these children have had the opportunity to be vaccinated against COVID-19, as a vaccine is not currently available for them currently. So far, the symptoms of Omicron do not appear to be more severe in children, and the increased hospitalization rates are likely due to the increased transmission of the virus in our communities. The best way to prevent hospitalization in children from COVID-19 is to get them and those around them fully vaccinated. In Montana, as mentioned earlier, the rate of fully vaccinated children 5 to 11 years old is only 12%. Those aged 12 to 17 years old is 38% as of this past week, according to numbers from DPHHS. To be considered fully vaccinated, a child should have 2 doses of the Pfizer-BioNTech mRNA vaccine spaced at least 21 days apart, followed by a booster 5 months after their second shot for children 12 years and older. Until more children can be vaccinated, the Omicron variant is and the Omicron variant is under better control, other trusted and proven public health measures must be used to keep children in school. And this includes high quality masking due to the increased transmission of the Omicron variant in our communities. These masks should include 3 layers of cloth, a surgical mask plus a cloth mask, or ideally an N95 mask. Other proven public health measures to keep kids in school include high quality air filtration, hand washing, and physical distancing when possible. Given how many important questions parents have around the safety and effectiveness of COVID-19 vaccine in children, 10 Montana healthcare and public health associations have come together to launch a campaign to educate parents and get kids older than 5 years old vaccinated against COVID-19. The name of this campaign is called Your Best Shot MT Montana, and more information can be found at yourbestshotmt.com. As pediatricians, we truly care about answering all parents' questions about the health and wellness of their children, and we want to improve parents' access to answers that will set their minds at ease about vaccination from trusted Montana medical professionals. COVID-19 has had devastating effects on children, with over 175,000 children losing a caregiver to COVID-19 as kids spread the virus to vulnerable people in their household. This leads to significant mental health issues and orphaned children. 1/4 of US parents report that their child has had to quarantine because of COVID-19 exposure since school started this year, which has made many kids fall further behind in school. More than 85,000 children have been hospitalized due to COVID-19 in the United States, and the cases in children are now increasing faster than ever due to the Omicron variant. Although serious side effects and death from COVID-19 are rare in children, it is important to realize that any child can develop severe illness, long-term effects, or death. COVID-19 has caused more than 1,000 deaths in children in the United States, which is much higher than the pediatric deaths related to seasonal influenza, which ranges between 35 to 188 deaths in children per year. Vaccination is the safest and most effective way to protect your child and family members from serious side effects or death from COVID-19. Please direct any questions about COVID-19 and the vaccine to your trusted local health professionals. Please check out yourbestshotmt.com and get your child 5 years and older vaccinated against COVID-19 today using the Vaccine Finder tool on the website. The time to vaccinate your child is now. We are all here to help answer questions and guide you to the right location to get the vaccine. So I want to thank you all for your attention today, and I would like to pass this to Dr. Greg Holtzman, who will field some of your questions.
Thank you. Sorry about that, having a little trouble getting on the picture there. Thank you, everyone. And I'm actually not going to answer the questions per se, but I'm helping to field the questions that come in from reporters. I do want to first say thank you to all our speakers for your commitment to your work in your field of expertise, and even more so for your caring and compassion towards your patients and towards the citizens of Montana. We really do appreciate all the work you are doing and for taking time out of your incredibly busy schedules today to be with us and help answer some of these questions. I'd also like to highlight and say thank you to Dr. Cole for his comments specifically about this new campaign that we at the Montana Medical Association with 9 other trusted Montana healthcare and public health associations have recently launched, called Your Best Shot Montana. Some of you may have seen some of the PSAs already on your favorite video streaming, but there's also the website that gets into a lot more information and hopefully is a starting point to answer those important questions that so many parents have. We all want to do what's right and what's best for our children, and having questions is necessary and important, and we want to make sure that people have a good source, a trusted source to go to. So that is available, and I hope you'll take your chance to take a look at that. And if you have comments or ways that we can improve it, please let us know. In addition to vaccine, it's essential to remember that now is the time to remain vigilant in the prevention of COVID-19 through our multi-layer mitigations that has been brought about by all of our speakers. Again, wearing your mask in indoor public areas, social distancing when feasible, washing your hands regularly, being in good ventilated areas, etc. And if you do acquire COVID-19, it's important that you stay at home to protect others and to communicate with your healthcare provider if you're at high risk for serious outcomes or start to have significant symptoms. Together, I do believe we can put the COVID-19 pandemic in our rearview mirror. I'd like to now open it up for questions. Reporters, please raise your hand using the Zoom function if you have a question, and we will make sure we get your question to the appropriate expert. Thank you.
First up is Sam Wilson. Sam, I'm gonna ask you to unmute now.
Yeah, hey, this is Sam Wilson with the Lee Paper State Bureau. I was just curious, I'm not sure who this is best directed to, but I was wondering if you've seen any indication that there's been anything, whether it's, you know, the previous Delta surge or the current surge that is kind of ramping up right now, that seems to have related to a jump in vaccination rates. It seems like Montana's rate at least has been fairly stagnant, you know, since at least last fall. So I was just curious if you're seeing any response to increasing caseloads or hospitalizations that seem to be driving more people to get vaccinated.
Thank you for that question. Can I give that to you, Dr. Koo, to start off with? And Dr. Cook, if you have anything to add, please jump in.
I just want to make sure that I understand your question. So what you're asking is, it's that our current vaccination rate has that influenced our rate of hospitalization and number of cases? Is that the question you're asking?
No, I'm sorry if I wasn't clear. I meant more that I'm wondering kind of what has been influencing vaccination rates, if anything. So, you know, the surge that we saw in late summer and into the fall, or the surge that we're currently seeing now, whether there's been any noticeable increase in vaccination rates in response to that.
Okay. I can give you my little perspective, and I think Dr. Cook-Shimani could also kind of chime in a little bit on her part. But you know, I have to. One of our hopes was that with this recent surge, that it would have resulted in a significant increase in hospital vaccination, and not just in Yellowstone County, but also around the state. And if, you know, not saying that it didn't help. I mean, there was a few percentage increase, but not to the degree that we were really hoping that, that would have that would elicit the response that we're hoping for. My hope is that now that seeing how rapidly this variant has spread, you know, in our state is just, you know, our case numbers have jumped up, you know, double, tripled very quickly in a very short period of time. My hope is that people those who have not been vaccinated will get incentivized to get the vaccine. Just hope that they will do it sooner than later, because certainly there is still a period of time where they can get the vaccine, and so it's not just even though you know, that's something that can be done very quickly, and then that will instantly mitigate the likelihood of someone get Omicron variant. So, but I'll let Dr. Cook-Shimani kind of chime in on her. I mean, what she's seeing more on the numbers of the vaccination throughout the state.
Sure. Thank you, Dr. Koo. And I would say that the data supports what Dr. Koo is saying. You know, we often look at the first dose administered as an indication of kind of whether there's some movement towards increasing vaccination in response to these situational factors. And as I look back through at least the last 3 weeks of reported data, it's stayed about the same, if not a little lower. And we just don't have complete information for this week. That will continue to kind of accumulate, and we'll have a better idea next week what the data looks like in terms of weekending the January 7th. But I will just add to that and just reinforce, because I know it's been, stated many times, we still see that being vaccinated and getting your booster when eligible is the best thing that people can do to prevent severe disease and severe outcomes with COVID-19 and death. And so I just wanted to reinforce that in follow-up.
And if I could add one other thing, and it looks like Dr. Cole might have something he'd like to state too. I think it's really important that we know that there's a lot of misinformation out there and confusing information out there. And one of the goals of this press conference, and also with the campaign, Your Best Shot Montana, is to give people another source to get to their healthcare providers, their physicians, to answer those really important questions. I think if you look at the data and the information, many people will move forward towards getting vaccinated, but they have a lot of concerns and questions. And we want to be able to help get people to reputable sources to get that information, including your healthcare provider. And with that, I'll hand it over to Dr. Cole, because I think he would like to say something also.
Yeah, thank you, Dr. Holtzman. And I totally agree with what you're saying. In the pediatric world, we find a lot of success talking one-on-one with our families in the exam room. I think the tricky thing is there's so much information flown at people from every direction that it's hard to know what to believe and what to trust. So that's why this campaign is focusing on Montana physicians and healthcare leaders to get the information out to every single Montana family where they can get their questions answered and have a dialogue with their trusted health professional. And I think that's the step that we need to turn our vaccine rate around.
Thank you. Next question.
Looks like we have Shaylee Ragar. You can go ahead and unmute. Thanks, Shaylee.
Great, thanks. This is Shaylee Ragar with Montana Public Radio. I have a question for Rich Rasmussen. You spoke about workforce shortage at the hospitals, what hospitals are facing with this new surge. I'm wondering about the governor's incentive program to bring nurses to the state. I'm wondering if that incentive is yet available, and if you know of any hospitals who are trying to take advantage of that, and whether, if you could kind of talk us through how that works, that would be wonderful too. Thanks.
Sure, thank you. No, we are very pleased with the governor's new initiative to help provide resources to assist us with recruiting healthcare practitioners to our state. I cannot tell you exactly how many hospitals have signed up or the current status of this, but what I can tell you, there has been tremendous interest in that. So Shaylee, if I can try and get you that additional information, I will do that for you. But it's this type of innovation that's what we're going to need to be able to continue to rely upon in our state. I mean, the rest of the nation is competing for the same level of talent. And so Montana has to come up with innovations that are going to help us to be successful. And this is one of them. I think this, coupled with the generous gift from to MSU's nursing school, is another example of that. And the work that our hospitals are doing day in and day out to continue to provide additional incentives for folks to relocate to our state is what it's going to take. But this is a long-term investment that we're all going to have to make in being able to grow our healthcare workforce. This is not something that we can solve overnight. And so it's something that I think for policymakers, it's some for community leaders, and certainly it's for the healthcare leadership as well, to ensure that we're continuing to build our own farm team here in our state to be able to meet the healthcare needs as we continue to grow. Montana is one of the fastest growing aging states as well. And so if we want to continue to be a place for folks to retire to, that's one of the first things you look at when you retire. You want to know how far you are away from the nearest healthcare provider. If you're a new business looking to relocate, healthcare is a consideration along with education and housing. And so we have our work cut out for us on this, but that initiative, we believe, is a really good down payment as we continue to find ways to invest and bring folks to our state. But we'll look for those numbers specifically for you.
Thanks, I appreciate it.
Thank you.
Our
Rich.
next question is from Jonathon Amba.
Hello, thank you everyone for holding this press conference. This is Jonathon Amba from the Montana Television Network. Possibly for Mr. Rasmussen, I don't know. I heard that you were saying that this has the potential to be the most serious COVID surge that the hospitals in the state have had to deal with. And I was curious if you guys have, judging from what other states have seen, if you have any idea as to when we might start to expect to see some spike here in this state, if it's a matter of weeks potentially, or what you're looking at, and if there's anything being done at this point to try and get ready preemptively.
Sure, and certainly I'd encourage Dr. Koo or Dr. Cook-Shamanik to jump into this too. But if we look at, in fact, just before we were on this press conference, I was looking at some of the data showing our surge compared to the rest of the nation. And it seems to be that we have this constant flow of hillscapes that we have to climb. And so while the rest of the nation is in the midst of a surge, we kind of tend to see ourselves in a downward coast, and then we find ourselves popping back up again. And so with the rest of the nation going through a surge, we fully expect we'll see it here. And the data that we've seen and how quickly this replicates, if we're seeing duplications every day or every 2 days of the total number of cases, intuitively, we would think that that would happen here as well. What makes this different is that it has the ability to pierce through our ability to ward off the disease. And so our immunity that we have as healthcare workers, and the vast majority of our healthcare workers are immunized, the ability to pierce through that and have the potential of taking that person out of our workforce while they isolate or if they quarantine is what we're concerned about. And so when we look at, not only is it an issue related to the number of patients, but our ability to care for the patients that we have when we take our caregivers out of rotation for being able to work in the hospital. So it's really, we look at it two different ways. It is, to summarize it, it is the volume of patients we have, but also ensuring that we have enough caregivers to be able to care for those patients. And if they've been exposed or they're having themselves to be isolated or quarantined, it makes it hard to meet those staffing needs that we have in our facilities. And that's why I referenced, well, we'll be looking back again at how do we manage or curtail some of our services to ensure that we do have enough staff to meet those patient needs at that time. And if Dr. Koo or Dr. Cook-Shamanik have any other thoughts about the replication or the growth of this disease, that's where our concerns come from.
I think, in addition to adding what Mr. Rasmussen has commented, I think that what makes this different than some of the previous surge is that it's not just the sheer number of COVID-19 hospitalization that we're concerned about. Many hospitals currently are running, including Billings Clinic, are having full, their hospitals at full capacity for a variety of reasons. And there is, this is typically a very busy time of the year, from looking from historical accounts to that. We have other, to other issues that's going on. We have now we're having a flu season this year where we didn't have one last year, and we're seeing more hospitalization due to influenza. So, and then finally, it's even though there's discussion about limiting medical services, there's a reluctance on our part to do that because we saw the consequences of limiting all the services back, during the first surge, where that resulted in a lot of patients are coming back who are sicker than they were, if they sicker than they typically would have presented if they would have been seen earlier. So there's this, so it's really a challenge that to say, well, it's all going to be due to the surge, and that is a concern. But on the other hand, there's so many other moving parts to this, and then add on top of that to have the adequate staffing and the personnel with the appropriate skill set to be able to provide these services. That just makes things even a lot more challenging. So I wish I had an easier answer to say. There's just so many moving parts, and a small surge will, it doesn't have to be the same level of surge that we experience, but because of what's going on, a small surge in COVID-19 hospitalization will put us over and strain our healthcare system significantly.
And if I might, I'm sorry, Maggie, I just want to make one other point. When we talk about that, we're talking about hospitals here, but let's not also forget our other healthcare providers. So when we look in the long-term care space, our nursing homes, assisted living, they are impacted as well. So when they have someone in their team that has been a close contact or someone that has to be quarantined, it has tremendous impact on our long-term care providers. And that really hasn't been a very large part of the discussion that we've had over the last few months with this surge, but it has an impact on that very important service provider group as well. So I apologize, Maggie, but we tend to forget the long-term care piece of this as well. And as hospitals, we need to be able to have places to send our patients. So whether it's to our critical access hospital bed space capacity or to our nursing homes, we can't effectively decompress when we need to create capacity for the most critically ill if we don't have a place to send the patient. And so those other parts of our continuum of care are really important, and they're impacted as well.
I think those are all really important points. Thank you, Rich and Dr. Koo. I don't have anything to add to that. It's incredibly complex.
Thank you very much.
Thank you. Lauren, do we have any other questions?
Yeah, it looks like we have a follow-up question from Sam Wilson.
Please go ahead.
Yeah, thank you. My other question was, I'm just kind of curious, from the current case counts we're seeing, obviously they've been jumping over the last couple of weeks. And maybe this is best directed at Dr. Cook-Shemanek, but I was curious, given all the at-home tests and rapid tests that are being taken and presumably not reported to that statewide total, do you have any sense of kind of how reliable those daily statewide numbers are, and kind of what, how much of that is being captured out of kind of what the actual total caseload is?
It's a really good question, and DPHHS recognizes that not all of those positive results from at-home tests are going to be reported to local public health departments. And so we know that that's going to contribute to some of the undercounting of COVID-19 circulating in different communities. So it's a good point, and we do recognize that that is a limitation of what we're currently reporting.
And I guess maybe if I could just follow up on that a little bit, I'm guessing you probably don't have like an easy multiplier or anything that you can apply to the official numbers that are being reported to the state. But do you have, any kind of sense of, kind of how much more widespread it might be than what those reported numbers are showing?
I don't have a multiplier specifically. Dr. Koo, I don't know if you've heard any estimates of what the true case burden might be, taking into account those rapid or home tests.
No, I don't. And I think, and there's also all these other factors of test shortages and difficulties for many people to find the home test in at their local Walmart or grocery store. So, and then certainly, then you have those who are actually, if you have a percentage of folks who may just choose not to get this tested, and you have that also to add into that. And we don't know how big that population is. Because and they may choose not to get tested for a variety of reasons. They don't want to feel guilty of not showing up work, or they don't, things like that. So there's a lot of different reasons for that. So yes, it's a moving target, and there's no right answer to that. We don't have an accurate number. We just have an estimate, and a sense based on that we can. Based on some of the other indicators we use, like the number of visits to doctors, to a doctor's office for just respiratory illness or things like that. So we take all those different indicators and kind of get a more of a sense rather than an exact number number of actual cases of COVID-19. That's what that is being found in one, rather in a county or in the state. So.
And Dr. Koo, let me just ask a question to respond to Sam, just something to think about. If we were able to generate the sales figures of the number of at-home tests over the course of a week and apply, a positivity rate, would that kind of give us a good ballpark of what we might be looking at? So if there were, 10,000 sold in the course of a week, we had a positivity rate of 20%, we know we have 2,000 additional cases. Would that be a safe, assumption? I think it's a great question, that we haven't even begun to think about in our field. And it's data I'd love to collect in mine. So I was just kind of curious.
That would be a great study to do.
I think that's an example of how much we're leaving behind. So our numbers, in all likelihood, if we're honest, are much higher when we move to more at-home testing.
No, you're right, and this is actually, as things gets, because of all the different factors. I mean, it's not one thing that we could use to get a sense of where things are going, but that we take all these different things, like number of tests being purchased or number of tests being done, and even sewage water data. That's a big thing now that kind of went away for a while, but now there's a resurgence of using that to get an estimate of how prevalent the disease is. So the point being is that there's no one way to do it, and there's really the best we can do is to give a relatively an estimate, but to get an exact number of cases in Montana is very challenging, very difficult. There's people coming in, coming out. Do you count the people who just left? And I think this happened. Recall when we first started reporting. One of our first cases of COVID-19 was a woman who was diagnosed in, I think, Virginia. I mean, and so how do you count these? I mean, it got really, really complicated. And so rough estimate and a sense of based on all these indicators is probably the best that we have right now to get a sense of what's actually going on in Montana.
I think if I could try and summarize what you all said from an epidemiologic point of view and clinician is, one, we don't have the exact numbers. However, the trends are what we're really looking at, and that's what's most important. And we know the trends are going up. So there's issues to address and to move forward. We also are watching very closely on the trends that we are concerned about, which would be hospitalizations. And of course, we don't like to see any deaths. So those are things that we're watching very closely. But the bottom line for the public is very clear that our numbers right now, the Omicron wave is starting to hit Montana. And I think we need to realize that and continue to respond appropriately, as so many of our speakers today have spoken about.
Gotcha.
Lauren,
thank you very much.
You're welcome. Lauren, is there any other questions?
It doesn't look like it, but I do want to just provide one additional moment for folks to chime in with any last questions.
Well, thank you. My duties are done here. I will hand it back over to Dr. Robertson, the president of the MMA, to help close out our press conference. Thank you so much. Dr. Robertson?
Thank you, Dr. Holtzman. I really just want to say how much I appreciate the time and effort and expertise that our various speakers have brought to us today. I think one of the biggest things, I just saw this word the other day, we have an infodemic going as well as a pandemic. And sorting through misinformation, disinformation, what's available, what's not available, what's recommended and what's not recommended. Those questions really are very best answered by individuals talking with their trusted providers, trusted physicians across the state of Montana. I think that certainly this new website, yourbestshotmt.com, is going to be a source of good information, trustable information. And the more we can encourage people to talk to their own physician, talk to their own pediatrician about their children's health, those kinds of resources are actually invaluable. I really want to also just say that I appreciated Mr. Rasmussen's comments about critical access hospitals and nursing homes, long-term care facilities. Those are the places where I work. We have literally within the last week in one facility had our index case of influenza A. Facility had to be closed down. Today, we have our first and index case of a worker with a positive COVID test, even tighter shutdown now. So this is definitely affecting every bit of the state of Montana. I absolutely want to echo the thing that everyone has said, which is that getting immunized seems to be the best way to prevent serious disease. It seems to be the best way to protect those around us who cannot be immunized for whatever reason. It doesn't matter, age, illness, whatever. But to be able to continue, we will need to get more people immunized and keep going that direction. I thank you very much to all the speakers, every one of you. Appreciate it. Lauren?
I think we're all set. Thank you all for joining us today.
Thank you.
Thank you.